Hello everyone, welcome to our team presentation. So on this occasion, we're going to present our team research paper entitled AI Chatbot Technology to Predict Disease, a systematic literature review. So first, I would like to introduce our team here. So our team here consists of me, Rinaldo Robertson Jaya, and there's also two of my research partners, Vincent Velasco and Kevin Dedisiawan. We are from Binus University, majoring in computer science department. And also, I would like to express my gratitude to our advisors, Mrs. Maria Susan Anggraini and also Mr. After Kurniawan, for provided us guidance and mentorship throughout the research process. So this presentation will be divided into 5 main topics. The first one is introduction, the second one is research question, the third one is methodology, the fourth one is result and discussion, and the fifth and the last one is conclusion. So let's start with the introduction first. So did you know that artificial intelligence is revolutionizing the way we approach healthcare? Imagine if a chatbot could predict if you're at risk for a certain disease. We know that AI involves creating intelligent systems that can mimic human-like cognitive functions. Among various AI applications, chatbots have become particularly interesting. These are programs designed to communicate with users through text and can also simulate human conversation. On the other hand, healthcare, a field where timely and accurate information is crucial, has started embracing chatbots. These chatbots can engage in conversation with patients, assist in triaging, and even provide medical advice for early intervention. Despite the promising application, there is still limited understanding of how chatbots can be effectively utilized in predicting disease, which is critical for early intervention. By understanding the capabilities of AI chatbot itself in disease prediction, we can unlock new avenues for enhancing patient care and potentially saving lives. This research aims to explore and analyze the use of AI chatbot technology in predicting disease within healthcare settings. Now that we have some background information, let's move on to the specific research question we aim to address. So this brings us to our research question. The first one is, how can chatbot technology be implemented in the healthcare system so that it can improve the effectiveness and healthcare quality? The second one is, what kind of algorithm on machine learning are we going to use to get the best performance for chatbot technology? The third one is, how can chatbot technology be used to improve the quickness and accuracy in the process of diagnosing disease? The fourth one is, what are the challenges faced in the implementation of chatbot technology in healthcare? As for the methodology section, my research partner Vincent Velasco will take over to present it.
The next topic that we're going to cover is the methodology that we use in creating our research papers. This slide is a figure that represents the process that we use in making our papers with systematic literature review methodology. This slide is about the study location. The search terms used were medical chatbot, healthcare chatbot, and also healthcare chatbot diagnosis. A total of 70,300 literatures were obtained using these terms on Google Scholar, and 300 literatures were obtained by combining literatures that were found when searching each individual terms on ResearchGate. After some considerations, the number of papers used in this research were numbered down to just 40. This slide is about inclusion and exclusion criteria. The first inclusion, the studies that we use must be an international paper. Papers used publication must be in between 2018 and 2023. Papers is written in English language. In the last inclusion, the paper's topic is about chatbot usage in healthcare system. Next one is about exclusion criteria. The first exclusion criteria, the study that we use must be an international paper, so it can be an article media or etc. Paper year's publication is before 2018. The paper is written in other language other than English. The last exclusion, the paper's topic doesn't revolve around chatbot and its usage in healthcare systems. The next slide is another figure that represents the process of selecting which journal we're going to use in making our research papers by using inclusion and exclusion criteria. The first step we have for the journal, and we found there's one journal that is not an international paper. The second step, we found there are 5 papers. The year's publication is below than 2018. The third step is we found one paper that is not written in English. And the last step, we found there are 3 papers that's topic is not relevant to our topics. And the next few slides represent the order of the journal that we use in analyzing and synthesizing studies for our research paper and the method that the author used in the research papers. The next topic is going to be presented by Kevin Dedisiawan.
Next, I'd like to talk about the result and discussion from our research. First of all, let's see this table that shows the number of papers to answer each of our research questions. From this table, we can see that for our first research question, we found 6 papers that could provide answer to that research question. We found further 9 papers that could answer our second research question. We found 5 papers that could provide answer to our third research question. And lastly, we found 4 papers that could provide answer for our fourth research question. Next, I'd like to discuss about the result from our research, starting from the first research question that's about how can chatbot technology be implemented in healthcare system so that it can improve the effectiveness of healthcare quality. So from our study, we found that chatbot can be used to provide support and give health-related information towards the patients. Chatbot can also be integrated into the healthcare system to provide better communication, better user experience, and also improve the accuracy of the disease diagnosis and give a more effective healthcare service towards the patients. Chatbots can reduce the time and resources needed in disease diagnosis so that patients with little time and little access to proper medical facilities can still get accurate disease diagnosis based on their symptoms. Using machine learning technologies or algorithms, we found that chatbots can also be used as a diagnosis tool to help healthcare providers, such as doctors, to determine the correct treatment, personalized treatment, based on each patient's symptoms and conditions. Next is our second research question. What kind of algorithm on machine learning are we going to use to get the best performance from the chatbot? So we found plenty of machine learning algorithms that can be used to properly diagnose a disease. The first algorithm that we found is RAS algorithm to diagnose COVID-19 and support vector machine or SVM to diagnose heart disease. Another algorithm that can also be used is AMIL and Bayesian network. The last algorithm that we found that can be used is random forest algorithm. And from all of these algorithms, we found that random forest has the best accuracy compared to all of the other algorithms. We found two research that use this algorithm to predict disease, and they have 87% and 98.995% accuracy for their chatbot. We also found that the use of XGBoost library can also improve the random forest accuracy, and thus it's recommended to pair XGBoost with random forest. Next, I'd like to continue with the third question. How can chatbot technology be used to improve the goodness and accuracy of the process of diagnosing disease? So we found that the use of natural language understanding and natural language processing and NLU and NLP respectively can be used to improve chatbot understanding of the patient's inputs and enhance the chatbot effectiveness in general. We also found that the use of algorithms such as term frequency or inverse document frequency or TF-IDF can improve the chatbot uh, understanding of patient symptoms. For example, if the patient have a certain phrase or words that are used repeatedly to describe their condition, chatbot can gather that as information and thus make a conclusion based on that data. For our last question, that's about what are the challenges faced in the implementation of chatbot technology in healthcare. We found that from our research, we found that there's one underlying issue, and that's the lack of standardization for chatbot technology. There are two aspects that are lacking in standardization, and that's the first one is user interface, is how the chatbot is presented to the users. Is it as a computer or like a more human-like persona? The next is about language use. Is it more technical or is it more everyday conversation like language that are easy to understand? Lastly, I'd like to briefly conclude our presentation. The potential of chatbot in medical scene is very high. Chatbot can be utilized to assist medical professionals in diagnosing patients' diseases. Chatbot can be developed to have a more human-like interaction with patients to gather more information easily. But there are still some challenges faced by the chatbot, for example, the lack of standardization in the metrics. This can lead to the reluctance from the users to interact with chatbot as they are more comfortable in interacting with medical professionals. That will conclude our presentation for today. Thank you for listening.